Hello everyone, my name is Andrew. This is day 1 post-surgery of my recovery from a hip arthroscopy procedure to correct femoroacetabular impingement in my left hip. I'm going to make a series of videos to record my progress in recovery because as I was doing research on this surgery, I found it helpful to follow along with other video diaries and Instagram diaries of people who underwent a hip arthroscopy to correct a hip impingement. So I'll do those videos on my own just to provide a little more information for anyone else who may come along behind me having this issue with their hip and considering whether or not to get this surgery. It's a relatively new surgery within the last couple of decades, so there's still a dearth of information out there about it. There's some good info on Instagram, here on YouTube, on Reddit as well, but the more the better. Do keep in mind that I am just one person, and I'm not a medical doctor. I'm only speaking of my own experiences, so definitely consult with your own surgeon about any questions that you have. Everyone who records one of these diaries seems to reiterate the same point, which I will go ahead and again make here. You need someone to help you within the first week, at least the first week, most likely, after having this surgery. I am single and live alone, and I've got my house set up pretty well where I could probably manage on my own, but I did get a family member, my brother, to come stay with me, and that has been very helpful. You're definitely going to need someone to help you out, especially if you're on narcotics. You're at a fall risk, and your hip will be compromised, so you need someone around, a friend, a family member, a significant other. I am right now hooked up to the Arthroscopy machine. This is a combination compression and cold therapy machine. You should be prescribed something like this. Arthroscopy, Game Ready. There's a number of devices out there that perform a similar function. If your doctor does not prescribe such a thing, definitely get him or her to prescribe one to you. This is providing cold therapy for the operated hip. That is great for keeping the swelling down. It feels really good. There's the wraps on my calves right here are for compression therapy. That is to help prevent clots in the legs, to help prevent deep vein thrombosis. My prescription is to use this for 30 minutes at a time with 1 hour break in between, 5 times per day, or more if I like, but at least with an hour break in between to avoid skin damage from the skin being too cold. I've mostly been sitting here today just kind of watching TV, getting up hourly or a little bit more frequently to move around. It is critical that you do move around and not just sit still. I've got both a walker and crutches where I can do laps around the living room here. My surgeon has told me to get up and move on an hourly basis. I've also been given a series of small exercises to do on my own before I start physical therapy here in 2 weeks. You may be prescribed something that's called a continuous passive motion machine. That is a device that bends the operated leg. I think the common protocol for that is to spend 6 hours a day in it. My surgeon did not believe that it was necessary to prescribe one. Perhaps the effectiveness of them is a little bit in question, and I don't know that my insurance would have paid for it anyway. But talk about that with your doctor. That may be something that your doctor prescribes. As far as limited range of motion, I was not prescribed a hip brace. My surgeon did not believe that I need one. Again, different protocols for different patients may be a little bit different, but my restrictions are hip flexion to a maximum of 90 degrees. Hip flexion is the lifting of the hip off of the ground or raising it towards the torso, and I'm limited to a maximum of 90-degree angle between the top of the femur and my upper body. There is no way that I will be even approaching a 90-degree angle. I get it up to about right here, and it starts to feel stiff and a little bit tight, so I'm just going to go ahead and take it easy there. I'm also not to bring my operated foot when I'm standing straight up. I am not to bring that heel back behind my right heel. And I'm also to keep limited to only small angles, rotating the hip internally or externally. That's pretty easy to do. So the surgeon was probably right that I don't need a brace. But again, every patient is different. You may be prescribed a brace, so discuss that with your doctor beforehand, definitely. And then again, I was given some small exercises to do on my own before I start PT here in a couple of weeks. Physical therapy protocols, again, tend to differ amongst surgeons. I've heard of some people starting physical therapy the same day as they get their surgery. I've read about some starting between 1 and 3 days afterwards. I heard 2 weeks afterwards. I've heard even longer in a few cases. But I strongly recommend that you talk to your doctor before the surgery and understand what the physical therapy protocol will be so that you know that there is a plan. I did come across a couple of horror stories of doctors doing the operation not getting proper physical therapy prescription to their patient, and the patient is just sitting there wondering what's supposed to happen next. The physical therapy needs to be started relatively soon to avoid the development of scar tissue. Other than that, though, I feel pretty good today. My hip is a little bit tight. It's it's sore. It's like a couple of days after having done a hard and heavy workout. The pain level has been manageable. It either doesn't hurt that much, or the Percocet is doing its job, or some combination of the two. I'll be taking Percocet for the next 4 days, up to 5. Hopefully, if this pain level stays where it is, then that's going to be totally manageable. Other than that, I'm just going to take it easy, follow physical therapy protocols, go to my follow-up appointment here in a couple of weeks. I did have a follow-on conversation with the surgeon today. He was confident that this is going to fix my issue. Maybe in some later videos I'll talk about exactly what the issues were and what the doctors found, because all of our bodies are built a little bit differently. People have different kinds of things go on during this surgery, and I'll be honest, it is a big decision to make. This is a long recovery road. It is not I'm on crutches or a walker for 2 weeks and then I'm back to everything functioning normally. It's a big decision, and I hope that I can document a successful recovery here, and that this information that I provide will be of use to other people. Thanks for watching, and I'll make some more videos soon.